following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Emily Winstead, Occupational Therapist with Cleveland Clinic Mercy Hospital. Good morning and welcome to the show, Emily.
Hi, thanks for having me.
During the month of April, occupational therapy recognizes the benefits of the specialized healthcare services. Many of us do not know what an occupational therapist does or how they care and benefit our lives. When injury strikes or long-term wear on the joints and muscles requires rehabilitation, an occupational therapist, also known as an OT, provides the necessary exercises to get us back into our daily routines. Simply getting out of bed may be a challenge for one, or moving from one position to another can become a problem we need to overcome. Occupational therapists have studied the movements required to make these transitions happen safely and to retrain our newly repaired body part to do the job. They know the therapies to help improve the weakened muscles and the alternatives when others fail us. For every age and ability, occupational therapists provide care to improve the quality of life for each patient. This morning, we're going to talk with Emily about the services occupational therapists provide. We'd like to remind our listeners that our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So, Emily, again, welcome to the show. We would like to thank you for your service as an occupational therapist, especially during this pandemic. Please tell our listeners about yourself and responsibilities at Cleveland Clinic Mercy Hospital.
Hi, yes, thank you for having me. So I've been an occupational therapist for a total of about 6 years now. 2 of those years have been here at Mercy. So a lot of what I do here at the hospital is centered within our acute care. So I work to evaluate patients to determine their ability to function in their everyday life following any type of an illness, injury, surgery, those types of things. So we go in and we assess the patients and see their coordination, their strength, their balance, activity tolerance, to help make a determination if they're able to return home and be independent in their daily lives. Can they do things like their own bathing, dressing, those types of basic things that we each do each and every day. So we help with discharge planning, determine, do the patients go straight home from the hospital or do they need further therapy before that? And then if they do need further therapy, we try to work with them daily here in the hospital. So,
okay, when we hear the term occupational therapist, the term seems to imply that the focus would be on helping a patient return to their occupation or job. However, we know it means so much more. So can you explain the services that an occupational therapist can provide at Cleveland Clinic Mercy Hospital, and how important your services are to maintaining the quality of your patients' lives?
Yes, so there often is a lot of confusion regarding the title of occupational therapist. When we introduce ourselves, we often hear, "Oh, I'm retired. I don't need you to help me. I don't need any help from you." So I want to clarify what that term really means. So when we consider occupation, we're referring to any activity that a person will do each and every day that gives their life meaning and purpose. So these tasks will help to influence who a person is, kind of shape who they are. These include things of what we label as activities of daily living. So those are basics of bathing, dressing, being able to use the restroom, feeding yourself. Then we have instrumental activities of daily living. So that encompasses cooking, laundry, grocery shopping, managing medications, managing finances, driving. We also consider sleeping, social participation, and then for some of our younger clients, things like being able to engage in school, education, play. So you can really see that it's such a broad range that we work with and consider in our occupation. It's our job to address whatever deficits a person might have that are impacting their participation in these types of activities. So, for example, if a person comes in and they have an open heart surgery, they might not have the activity tolerance, the endurance or balance to be able to do something as simple as bending over and putting socks on or washing their lower body. So we would work with those types of things, teach them strategies to be able to perform all these types of tasks, so that they can return home and be independent in their life. And helping a person learn to regain independence provides them with a sense of value. And a lot of people find satisfaction in that, in being able to do those things for yourself, rather than having to ask somebody to help you with something so simple as brushing your teeth.
So, what injuries or diagnoses might indicate a person needs help of an occupational therapist? And how do you evaluate these needs?
So everything, really, thinking about any kind of diagnosis that you could really come up with, we most likely will work with that. So just some examples: people who have suffered stroke, any kind of a fracture, traumatic brain injury, abdominal surgeries, total joint replacements, respiratory issues, so things like COPD, cardiac patients, developmental delay, neuro impairment, spinal cord injury, and of course, COVID. So we evaluate patients' needs by assessing their overall performance, looking at things like their coordination, their strength, balance, activity tolerance, their cognitive function. So can they sequence a task and problem solve through doing a task? And then we consider their safety awareness, their insight into their deficits, all the while monitoring things like their vitals and their safety throughout.
So, is it safe to say that an occupational therapist is really a person who helps us improve the muscles and movements required to complete our activities of daily living, like getting out of bed, getting dressed, and driving?
Yeah, I would say that's an accurate statement, with the understanding that it is so much more than just that. Like I said, we focus on those specific things of strengthening balance, coordination, but we really consider all of the components that make up that person. So the support system that they would have at home, cultural beliefs, all of those kinds of extras, the things, and focusing also on what's important to that person. So for an example, if somebody who is a corporate executive type comes in and they have a severe stroke that leaves them with one-sided weakness, we might focus on strengthening and coordination in their hand and arm, as well as that cognitive training to allow them to return to work successfully.
Okay, so it sounds to me like you've had a pretty hefty education here to learn all this stuff. So, so what are the educational requirements of an occupational therapist?
So currently, occupational therapists are required to earn a master's degree. So a master's degree for occupational therapy, that will be transitioning to a full doctorate in the year 2027. We also have occupational therapy assistants who need an associate's degree in order to practice. So both occupational therapists and occupational therapy assistants have to go through their schooling, and then we have to sit for a national certification exam, and then we have to also maintain state licensure in order to practice.
Do you have to be licensed in every state, or if you're licensed in Ohio, can you jump to any other state?
So you would have to have a license for each state that you want to practice in.
Okay.
All right, Julie. Emily, we know a lot about occupational therapy, and it begins in the hospital after surgery or sudden illness. Does it continue on an outpatient basis, and what types of places do occupational therapy practitioners work at?
Yes, so absolutely. So if you think of this as a ladder, like a stepping ladder, and each step is one step closer for a person to kind of regain their independence from the onset of whatever this illness or injury may be. So step one might be they're in the hospital setting after the said injury, and it's left them with some deficits. So they may then need to transition to what we call an inpatient rehab facility or a skilled nursing facility for further treatment and therapy if they're not yet well enough or independent enough to return home safely. They may then be able to return home after a period of time spent in that type of a facility to home with maybe family's help, And then occupational therapists do come into the home as well. We provide home care services to help people learn to function within their own environment. And then the last step of that ladder may be them going to an outpatient facility a couple times a week to kind of, quote, fine tune the rest. So not everyone needs to go through each steps of that process. It's really dependent on their individual needs. It just really depends how they are functionally when we're seeing them.
Crazy.
Time for a break.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
The following program is sponsored by the Medicine Center Pharmacies.
Okay. Welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Call our Medicine Center Pharmacy to learn about our prescription delivery program.
All right, we've been talking about occupational therapy today and how Emily at the Cleveland Clinic Mercy Hospital helps people get back on their feet and to their activities of daily living. Emily, I'm wondering if there's any specialties within occupational therapy field.
Yes, there are. There's several. So occupational therapists can specialize in things like wheelchair seating and mobility, aging in place. We can also earn a number of certifications. So you can be certified in stroke rehab, driver rehab, low vision, hand therapy, lymphedema treatments, brain injury, what we call industrial rehab. You can be a neurospecialist, diabetes educator. The list really goes on. Here at Mercy, we offer hand therapy, low vision therapy, driver rehab, as well as neuro and pediatrics.
That's pretty diverse, but I think a lot of those things you just mentioned, we kind of take for granted on our daily basis. You know, I mean, when you have some challenges, it's humbling very quickly. So That's interesting to hear you have so much to offer here locally for patients. What other disciplines do occupational therapy practitioners work with?
You name it. So we work very closely with physical therapy and speech therapy. Those are we're kind of a group. However, we work a lot with our social work and case management teams to help with things like discharge planning. It's very important for us to be in good communication with them. But we also work with the doctors, surgeons, nurses, psychologists, school teachers, in a school setting, and eye doctors, even for people who might have visual deficits after some type of a neurological impairment.
So, I'm kind of thinking that sometimes some of the things that you touch on probably overlap with a physical therapist or a speech therapist. How do those complement each other?
Yeah, so physical therapy would focus more on movement and mobility. They would help a person get from point A to point B. OT, we take a more holistic approach with it. So we're going to help people be able to do and participate in whatever activity they're doing at point A and point B. We address, the physical, the cognitive, and social demands of those situations. Speech therapy would focus a lot on things like feeding and swallowing, as well as cognition. So we do address these things in occupational therapy as well. However, we take a little bit of a different perspective. So, for example, our speech therapists here at the hospital are well trained to help people with their swallowing, with eating. So in OT, we might focus more on the person's fine motor coordination, strength to be able to grasp an eating utensil and actually bring their hand to their mouth without spilling food everywhere. So that might be more of our focus on it, while speech is focusing on the actual, swallowing of that food. So we all work in collaboration with each other. However, we each do serve our own purpose within that.
You probably already partially answered this question, but what types of diagnoses do occupational therapy practitioners work with? I mean, you just talked about a few things
Mhm.
that really are all the way across the map, and I don't know how you get all these people together. But anyway, what do you think?
So yeah, I mean, we do. I mean, we can really serve such a wide variety of diagnoses. I would say some of the top ones that we kind of work with most often here in the hospital setting, at least, would be people who have strokes, um, any kind of a neurological impairment where they're left with weakness, cardiac patients, so people who have maybe an open heart surgery, um, any kind of abdominal surgery, COVID patients, total joint replacements, um, spinal cord injury, mental illness, also cancer is another one. So it's really a wide variety.
What about okay? So what about occupational therapy following a total joint replacement? What do you do?
So, following a total joint replacement, a person often is given what we call a set of precautions. So, they've repaired a joint or put in a new joint, and a person has to avoid movements in a certain manner to avoid any kind of like a post-op complication with that in order for
Sure.
it to heal appropriately. So our job as occupational therapists is to go in and we teach a person how to maintain those precautions. We teach them their precautions and how to maintain them. So, for example, following a hip replacement, you might not be able to bend forward to reach your feet. So we can show you types of equipment. We have adaptive equipment that we can show you and let you try out and use in order to be able to do those tasks for yourself independently without asking for help. Um, Also, a lot of people end up having to use a walker after a total joint replacement. So they may not be familiar with how to use that walker. So it's our job to teach you safety with that, how to navigate through an environment. There's a lot that goes into it.
So following a stroke, I can imagine, all kinds of issue with voice and movement, et cetera, et cetera. How do you deal with that?
So you're right, a stroke can leave a person with a wide variety of deficits. Um, so we're focusing on things like strength, range of motion, coordination, sensation. Sensation can be impaired after a stroke. Um, Cognitive impairments. So, sequencing a task, being able to initiate a task and problem solve your way through something. Um, Visual deficits. Sometimes people have difficulty seeing out of one side after a stroke. So, we consider all of these components within the context of them being able to participate in those basic daily tasks each day.
Interesting.
Would occupational therapy address children's issues or working with children? I suppose there's a specialty for working with children versus working with adults caring for children, maybe.
Yes. So occupational therapy is involved with kids. You will find OTs in the schools. A lot of times in that type of a setting, they'll focus on things like handwriting, building skills for success in school. So a lot of handwriting, fine motor tasks that kids might need to do to, cut with a pair of scissors, that sort of thing. Also helping children to learn to regulate their behaviors for increased attention within that classroom setting. Um, and then we also will see children in an outpatient setting. They're also work on fine motor skills, language skills, cognition, those types of things, which we do offer pediatrics through Mercy at our Carrollton and our Tuscarawas County locations. And then as far as the diagnosis with kids, you're looking at more things like those who might be on the autism spectrum, ADHD, sensory processing disorders, cerebral palsy, those types of things.
It's the youngest child you've ever dealt with.
Well, I'll be honest, I'm not a pediatric occupational
Oh,
therapist.
okay.
So. I work with the adults,
Okay.
but we work with babies. So there are occupational therapists in the NICUs.
You work with
Wow.
you said babies?
Babies, yeah.
Oh my gosh! What do you do? I mean, okay.
Well,
What if the baby can't even talk?
Well, I mean that's a very common thing. So, if an infant's born prematurely, they haven't yet developed what we call this like a sucking reflex. So,
Sure.
occupational therapists can also work to help develop feeding skills in premature infants.
Gosh, incredible.
Yeah, there are some really specialized areas that we work in.
Do we break here now, Brad?
Yeah, I think we can.
Okay, we're going to listen to the news now. Okay, and the weather. So it is the bottom of the hour and time for the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
The following program is sponsored by the Medicine Center Pharmacies.
Okay, welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Emily Winstead, occupational therapist with Cleveland Clinic Mercy Hospital. We have a lot more to cover this morning, so let's get back to the show.
All right. Well, I guess we'd be remiss during all this COVID-19 adventures not to talk about how COVID-19 impacted occupational therapy in your practice. So, what did you have to do to help people with their OT while COVID protocols were in place?
Yeah, so COVID was a big learning curve for all of us. I think early on, people weren't really thinking about early mobilization of patients or what long-term recovery might look like. They were just focused on keeping people as healthy as they could. So no one was really assessing the patients that were here with COVID's ability to get up, move around their hospital room. So we kind of helped with that, being the first ones to kind of get in there, therapy services being the first ones to get in there and really get these people up and moving, after spending days and days in hospital beds with COVID. So we were noticing, massive drops in their oxygen levels when they would get up and move. So we really had to kind of take that under our wing and work with these patients to regain enough strength and endurance to be able to just stand up. It was pretty serious, and then, like I said, we're still kind of seeing what the long-term effects of all this are. So, we're seeing long-term cognitive changes and persistent musculoskeletal weakness, which is impacting people's performance in their daily routines. Not to mention the psychological stress that this brings people. So, they're left with fear and anxiety with having this potentially life-threatening illness. So we, especially here in the hospital, we were working with people to kind of bring them things to do during the day, activities that they could do in their room to kind of keep their emotional and psychological state a little bit better. Teaching them things like coping strategies to meet their emotional needs. Helping them figure out ways to connect with family because family wasn't allowed to come in and visit them. So, helping them navigate all of that. And we were kind of learning it along the way. The other thing that kind of we were impacted with was discharging patients. We were in a sticky spot because a lot of these patients were being discharged when they were still COVID positive. So they might not be able to go home to their family while they're still COVID positive and get help from them. Yet these people weren't in any position to be able to take care of themselves either. So we tended to keep people here in the hospital a little bit longer, and we were working with them. So, building a relationship with all these people over the weeks that we would see them. So it was a really big change for us in the acute care setting. And now, even after the fact, there are people who are still going, they've fully recovered from COVID in the medical sense, but they, like I said, have been left with maybe some long-term cognitive changes or weakness, or their respiratory status is just not what it was before. So we're still working with some of those people, even on an outpatient basis at this point. But, some of the big things that we kind of learned to teach people during all of this was relaxation techniques, just, to deal with, like I said, the stress of everything, breathing exercises, not only for kind of calming themselves and grounding themselves, but also for their respiratory endurance and tolerance. Energy conservation. So I mentioned some adaptive equipment earlier when talking about total joints. That can translate over to somebody with COVID. If they can't catch their breath enough to dress themselves, we have options that we can show you and equipment that you can use to make that easier for you. So it's been quite a bit of a change for us, but we're still learning.
I think we all are. So it sounds like so during this time, maybe you do a little bit more in the hospital than you were doing outpatient. Is that fair? Or is it just either way, it complements each other?
So it just really is dependent on the person and the severity of the case that we were seeing. If somebody was in the hospital for, say, almost a month, we would be working with them that full time, and then they may step down to either like a skilled nursing facility or home care or outpatient. It just is based on their functional level when they would leave the hospital.
So how can occupational therapy help people in the community?
So OT can be found a lot of different places in the community. So one of the big places that you'll find us is in schools. So they'll work in schools with children. They do after school programs. We also are involved with things like health promotion in the communities, mental illness, support groups. So we also can be found working in like the county boards for developmental disability. There's a thing called Delay the Disease, which is for Parkinson's. We also can be found in correctional facilities, senior centers, homeless shelters. We're all over the place.
Everywhere.
Yeah.
So do you go to the patient's home?
Yeah. So not me specifically, but there are plenty of occupational therapists who that's their job. They work in home care is what they refer to it as, and they will go into a person's house and work with them in that setting to help them maximize their functional independence at home. So whether that's being able to stand in their own kitchen and cook themselves a meal, be able to get in and out of their own bathtub or shower, in and out of their own bed, those types of things.
Is there okay? Obviously, you have an office and you have a central area for physical therapy and things like that, or do you send them to your other facilities for physical therapy, exercise? I'm thinking about North Canton, up on Whipple, that sort of thing.
So all of the above. I mean, here in the hospital, it might just be the person right in their room. We kind of use the space that we have available. We will get them out in the hallway to kind of practice walking and balance and some of those more movement involved tasks. Then we do have a therapy gym available. We have a couple therapy gyms in the hospital here we can take patients to if we need to practice some more specific things. Like, for example, after a total joint replacement, we do have a mock bathtub that kind of simulates for when they're going to go home, because it's different. Getting in and out of a bathtub is going to be different after you have a new hip than it would have been before. So we can practice those things with you right here in the hospital. And then as a person transitions, if they're no longer just an inpatient in the hospital, then they might go to one of those next step facilities, so a rehab center or a skilled nursing, and they would have their own therapy gym there. And then if you think about outpatient, that's when a person's living back at home, but they might come into our facility 1-2 times a week and be able to use the equipment that we have at those locations.
You were saying that during, I suppose, the heavy part of the past pandemic, the highest volume of patients, that you were keeping them somewhat longer. Were you sort of holding off, or the hospital holding off patients from coming into that program, or did you continue to stay with that program?
Do you mean not taking on any more new patients?
Right. Yeah, that's really what I mean. Yeah.
So, I mean, our job was kind of dependent on what the doctors were bringing into the hospital. So we were seeing everybody that we could. It kind of ebbed and flowed. There would be times where we didn't have a high caseload because I think people were maybe afraid to come to the hospital. And so we just didn't have a lot of people that we were working with, which allowed us to spend more time with the people who were here.
Sure. Well, elective surgery too was kind of pulled back in all the hospitals.
Correct. Yeah, the elective surgeries pretty much came to a halt a couple different times, and so that did impact our work here as well. We have since reserved our elective surgeries, so that has really helped build up our caseload.
Sure.
Yeah.
Okay. Interesting.
You mentioned earlier that in the community you can work with patients that maybe have mental illnesses or intellectual disabilities. Can you talk a little bit with our listeners about how that would look or how that would work?
Sure. So whether you're talking about mental illness or intellectual disability, that can really impact a person's ability to engage in daily life activities that are meaningful to them and help them lead productive lives. So our profession is vital in helping those individuals develop skills that are needed to be able to do those things. So when thinking about intellectual disabilities, we can help a person modify an environment or modify a task and help them to develop skills or an understanding of their skill level in order to help them be able to participate in society and the daily activities that they want to do. We also work to help in training caregivers or advocating for those people to have opportunities to be more successful just in basic daily life. And then thinking about mental illness, so that's a huge cause of disability in our community. Mental illness is a leading cause of disability. So we work a lot with those people to address things like being assertive, self-aware, coping mechanisms, interpersonal, social skills, stress management, help them find like the meaning of what their role in life is. So we do work with them a lot also.
I'm guessing our final break is here. So you're listening to Health Matters, and thank you for listening to the Health Matters today. And we are, of course, with the Medicine Center Pharmacy.
The following program is sponsored by the Medicine Center Pharmacies.
Okay. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us this morning, and let's get back to the last segment of the show. So, what can a person do if they are interested in having occupational therapy services for themselves or someone they know? Is that possible?
It is possible. So we work under a doctor's referral. So if somebody is interested in seeking occupational therapy services, or they would like to have just an evaluation to determine if they need those services, I would encourage people to reach out to their primary care physician. Your doctor can put in an order for occupational therapy evaluations. And so then we would be able to see you if you talk with your doctor.
A lot of people that don't have doctors. You know that, don't you? So what do they do?
Well, if that's the case, I guess it would depend on their need for services. But if they're in a hospital setting, we're recommended through, just depending why they're here in the hospital, we'll get referred for that reason. In the community, you would have to reach out through a doctor. So I don't. Yeah.
Okay, gotcha. Gotcha. I'm sure that let's see, how do I put this? I'm sure there are a lot of people. There's a lot of people out there who do need these services,
Mm-hmm.
and it is kind of frustrating when you're talking to many individuals. I don't have a doctor, I just don't have a doctor, so I can't do this, and it is kind of puzzling why so many people in this great country don't have physicians that can help them have a normal life, if you will.
Mm-hmm.
And they just go on and go on, without care. So what do we do with these people? I know this is not even in your department.
Well, so I know Mercy's primary care doctors are always accepting new patients. So you
Okay.
can come on down to us.
Okay.
Yeah.
And that's my message to people today. You need a doctor.
Yes.
Okay.
Yes.
A physician, a qualified physician. You need to be
Yes.
affiliated with the proper hospital authorities and all that sort of thing. So
Yep. You can just go on to the website cantonmercy.org and they can
Right.
find that information there on how to get connected with our doctors.
Okay, that's very good.
Yeah.
So would you like to share your website? And also, you just did that. And what about a phone contact or something like that for your department?
So you can find out more information about our therapy department if you do go on our website. So cantonmercy.org. And then there's a tab that says Specialties on there. So if you do that drop down tab for Specialties, there's a therapy services option that you can click on. There you'll find a variety of information about all of our therapy services and where those locations are. There's contact information on there. There's a phone number on that website. I also would encourage people to log on to, it's called AOTA.org. And that is the website that is for our National Occupational Therapy Organization. So you can find way more information than I've given you today about everything that we can offer you in occupational therapy on that website.
How many people are in your department?
In my department specifically?
Mm-hmm.
Well, now you're making me think.
I would think it'd be pretty large, and with all the people you had.
Yeah, so a ballpark here at the hospital, I'm just going to guess maybe 35 to 40 people.
No kidding. When you talk to other physicians, other diagnoses on this and that come in or brought in to whatever is needed.
Mm-hmm.
Is that what you said, I believe?
Yeah.
That's amazing. Gosh. What's your greatest success without a name?
I've worked with a patient who had a pretty severe neurological impairment. They thought that they were going to be essentially kind of paralyzed permanently. The doctor was for sure this person would never walk again. And this particular person was very determined. We talked every day and they said, I'm going to walk out the front door of that building. And I said, I'm going to help you do it. Well, he did. And it was a situation where everybody's lined up and tears are flowing because this person spent months recovering, daily exercises, they had to relearn everything that you think, everything that you get up each and every morning and just take for granted, brushing your teeth, putting your own shirt on, putting deodorant on. He had to relearn each and every single one of those things. And he did walk out and, he's fully functioning now. So that is a huge success for us.
Yeah. Younger person, older person?
Middle-aged.
Okay. So he was able to get back to work and all that sort of thing.
Yeah, I think he was probably retirement age if I had to guess. So
Hmm.
Um,
It's
he's
terrific.
probably on the golf course right now, is my guess.
Oh, good. Fabulous. Okay. Okay. What else you got, Brad?
Well, I was just kind of wondering, depending on your experience, it sounds like you can meet patients a lot of places. I know we get patients in the pharmacy that come in, and like my dad said, they don't have a doctor. Sometimes I feel like they're reluctant to seek care because they might be embarrassed about not being able to brush their teeth or dress themselves. Do you have a method to try to help patients make peace with those kind of situations where maybe they're intimidated by sharing their challenges with another person like yourself?
Hmm. Yeah, so I think that we get a lot of training in OT school to kind of address that component. A big part of what we do is developing a rapport with somebody. So we try to create a, a sense of comfort with them. We want to make them comfortable with us. We're not there to judge you, we're there to help you. And so, whatever is intimidating this person, we try to get them to a comfort level to be willing and able to share that information with us. A lot of what we do is very intimate. Like you said, brushing your teeth is not something that you want to openly tell somebody that you're struggling with. And so, we work to try to gain that level of trust from people to really get them comfortable with sharing that with us and allowing us to help them in regaining those skills.
Okay, here's one for you. Okay. Now, I recently had some surgery on my left arm for a nerve issue. Okay. And one of the things that was most difficult uh, right after surgery was buttoning a shirt
Yeah.
with with the left hand, if you can imagine.
Uh-huh.
So, what you're thinking about this? I was about half tempted to take a pair of scissors and cut the buttonholes bigger in the shirts. Okay, I thought, well, that wouldn't be any good. Okay,
So a couple suggestions for you. They sell something called a button hook, which is literally a little gadget that helps you hook a button. Um, we're all about gadgets in occupational therapy. We got a
sure,
lot of tools in our box to
sure.
help you. So they make a specific device for that, but you probably also could work on things like what we would call fine motor coordination. So there's so many things that you can do for that, just to get your precision a little bit better with those fingers.
A little, the little tight
Oh,
collar
those ones are the
collar
toughest.
buttons and stuff like that. I'm thinking, okay, come on, this isn't right. This isn't fair. Okay.
Or you could just wear a shirt without buttons.
Well, that's true. Or I could wear a short sleeve shirt.
Yeah.
Or a pullover shirt. Okay, well, that's my therapy request for
There
today.
you go.
Okay. So, Brad, how much time we got left?
And we got about a minute and a half. So, Emily, do you have any parting comments for our listeners about occupational therapy wisdom for the day?
Yeah, so I just hope that people were able to kind of gain a better understanding of what our profession is, and what we can do for people. Anybody who feels like they're not able to participate in or be independent with things that are important to you and help you kind of define yourself or get through your basic day, it's our job to help with that. So if you have an accident, an injury, an illness, a surgery, and you're asking yourself, now what do I do? I can't do the things I want to be able to do. Occupational therapy, we can help guide you through that and answer those questions for you, lead you back to participation in those day-to-day tasks that make you you, and help you be more independent with everything. So I encourage you to reach out and spread the word about us, and how much we can be of help.
Okay. Thank you very much, Emily Winstead, for coming
Thank
on
you.
the show today. Occupational therapist at Cleveland Clinic Mercy Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, Genuine Appraisals and Liquidations. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC. Thank you very much, Emily.